First question is, what is health informatics? And this is a complicated question, and it's not as easily answered as you might think it is. In a generic sense, it's the study of information and communication systems in healthcare. Now, that definition is so broad, it really doesn't provide much insight or much explanatory power. If you look at health informatics programs across the country, they come in many different flavors and many different types. As we'll talk about today, our program at Northern Kentucky University is very applied, very focused on the clinical and vertical supply chain environment, that is, how technology is used and how professionals use technology. Our focus is very much applied. It's about workforce development. It's also about applied research. But I think the most important thing to understand about health informatics is really it is the cornerstone as to changing how healthcare is practiced and delivered in the United States. And there's probably no business that is more data-centric and more evidence-centric than healthcare. And moving the healthcare, the practice of healthcare in all of its forms and all of its connectivity into the use of technology is really what health informatics is about. So why do you need to go to health informatics? Why can't you take a degree in nursing, or why can't you take a degree in information systems? And that's simply because it's a unique environment to work in. It's a clinical / patient-oriented culture. You need to understand the language and the culture of healthcare. If you don't have a clinical background, we make you take a class in the language and culture of medicine. Also, in your, we'll talk about in your capstone, we put you on site in a healthcare environment so that you can learn about this unique culture. Also, it's very mission critical. We had the a former CIO from Procter & Gamble, he's on our advisory board, make the statement, well, geez, if we screw up at P&G, we mess up a couple cartons of Pringles, you guys kill people. And that's really the truth. Health informatics is a mission-critical environment, and that's why you need specialized graduates. Finally, there's the various regulations. There's HIPAA, there's the FDA, and there's JCO. So just to name a few, as well as a multitude of state and other federal entities. There's unique hardware and software that you use. Understanding the technology of health information exchange and its relationship to clinical systems and clinical environment. And most important, it's understanding the context of healthcare. Healthcare is about service. Healthcare is about improving the life of patients. And healthcare is really a much different environment than a business environment.